The shoulder is truly an amazing structure. Our shoulders provide us the ability to do a spectrum of cool things, like throw a tennis ball 100 times to your golden doodle, or even catch a toddler falling backwards off a couch while still holding your cup of coffee. Our shoulders produce countless complex movement patterns. It grants us freedom and it grants us independence. But when those movements become painful, our world can literally come to a screeching halt. Shoulder impingement is one of the most common causes of shoulder pain, and it can affect our ability to reach overhead, get that messy bun perfectly messy, and even sleep through the night. After watching this video, you will know exactly what a shoulder impingement is and what you can do today to start easing your pain. Hey guys, I'm Carrie Heydrich. I'm a licensed physical therapist and the director of our orthopedic program here at EW Motion Therapy in Birmingham, Alabama. If you have found your way to our video, you have likely been living with shoulder pain and are probably to the point where you're ready to get some help and finding some relief. I truly understand how exhausting constant pain can be. Feeling limited in your everyday life and being restricted from activities that give you joy can be incredibly frustrating. After watching this video, I truly hope you are left with a better understanding of what shoulder impingement is, how to know if shoulder impingement is the cause of your pain, and the different ways that you can treat it so that you can get back to living your very best life. First things first, let's get to know the shoulder. The shoulder joint, or glenohumeral joint, is one of the most complex and mobile joints. It's actually made up of two parts: the head of the humerus, that's the upper arm bone, and the glenoid, which is part of the scapula or shoulder blade. The head of the humerus is much larger than the glenoid. This mismatch in size is actually why the shoulder has such an impressive range of motion, allowing you to do things like swim, change an overhead light bulb, and totally annihilate your neighbor at pickleball with your wicked backhand. But this amazing flexibility comes with a trade-off. The shoulder is much more prone to instability and injury. Now let's talk about the rotator cuff. This is actually a group of 4 muscles that surrounds the shoulder joint. These muscles kind of work as a team to stabilize the shoulder and allow for smooth, controlled movement in all directions. The most common impingement in the shoulder occurs between the area under the acromion and the head of the humerus. As the arm lifts up, the head of the humerus should glide down. If this glide doesn't happen, or if the space between the humerus and the acromion is abnormally narrow, the tissue between the two bones can become pinched. Over time, the repetitive pinching causes inflammation and pain, and in some cases, tearing of the rotator cuff. Because of this, shoulder impingement is most common in athletes and individuals whose sport or job requires repetitive overhead movement. Swimming, baseball, tennis, and volleyball all involve frequent overhead motions that can irritate the rotator cuff. Jobs such as painting, construction, and mechanics are also at an increased risk for impingement. So at this point in the video, you're probably wondering if the shoulder pain that you're having could be from an impingement. Let's start by reviewing the most common symptoms my patients with shoulder impingement have. There is frequently a painful arc of motion, primarily on the top of the shoulder. This happens when you're lifting up or out from your side at around 90 to 120 degrees. Patients may also experience the pain that radiates from the top of the shoulder to the elbow. This is often described as a dull ache that can become a sharp stabbing pain when reaching up or across the body. Unfortunately, this makes activities like performing the YMCA at your cousin's wedding reception or reenacting John Travolta's Saturday Night Fever moves a little less than impressive. Shoulder impingement can make it hard to sleep, especially if you're lying on that affected side. That constant ache might keep you tossing and turning all night, trying to find a comfortable position. Now that we've covered the symptoms, let's talk about how shoulder impingement is diagnosed. A healthcare practitioner will always start with a thorough exam. They will ask you about your symptoms and perform specific movement tests to pinpoint the problem. From there, they might use diagnostic tools like an X-ray, MRI, or ultrasound. An X-ray is used to check bone abnormalities or spurs that might be causing the impingement. An MRI can assess soft tissue damage like tears in the rotator cuff or inflammation in the surrounding structures. And an ultrasound can allow for real-time visualization of the shoulder's movement. This helps to identify areas of impingement or inflammation. Each of these tools provides important clues to help your doctor understand what's going on and how best to treat it. Now that we've covered how shoulder impingement is diagnosed, let's move on to the next big question. What can you do about it? It's important to get to the very root cause of shoulder impingement to actually effectively treat it. That's where physical therapy comes in. A trained therapist will guide you through exercises that target both strength and mobility, helping you to restore normal shoulder mechanics and function. They will utilize techniques like soft tissue and joint mobilization to reduce pain and improve function. Let's talk about medications, specifically non-steroidal anti-inflammatory drugs, or NSAIDs. NSAIDs can be very effective at managing pain and reducing inflammation. These can range from over-the-counter options like ibuprofen to prescription-strength medications like Mobic or diclofenac. Just be sure to follow your doctor's advice when using these. In more severe cases, your doctor might recommend corticosteroid injections. These injections deliver powerful anti-inflammatory medication directly into the shoulder joint. They're usually done in a doctor's office and can provide some significant relief, especially if other treatments haven't worked. Remember, every case is different, so it's important to work with your healthcare provider to find the right combination of treatments for you. Okay guys, that is it for today's video. I really hope this has been helpful in increasing your understanding of shoulder impingement. If you're experiencing shoulder pain, contact your local doctor or physical therapy clinic. They will be able to assess your condition and make the right plan for your needs. If you would like to know if physical therapy could be the right fit for you, click the link in the description below to watch our video called "What is Physical Therapy?" This video talks about what physical therapists do and how they can be helpful in addressing your needs.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.